My name is Ed Elliott. I'm a radiation oncologist with Cancer Care Specialists of Central Illinois, and I'd like to welcome you here tonight.
And it's just another one of the things that the people of Decatur should be very proud of, that the investment was made in Decatur, by Decatur people.
So we have 55,000 square feet of hope.
You know, this is a 10. This is top notch.
You know, at the Chamber, we talk quite a bit about a world-class community, and I think this is another example of a world-class facility.
The people who built it are the baker's dozen, and that's 12. It started out as 13 physicians. One of the 13 thought we were half-baked, so we reduced to just 12. And those bakers, if you could just raise your hand, because those are the doctors who's had the vision to invest here in Decatur. And work with Decatur Memorial Hospital to find out what do we need, what do our patients need now and over the next 20 years.
And the only reason that a building like this happens is because you have very good physicians who want to do good things, and they recognize that those things can be best achieved when they find the right model of partnership, and that's what they did here with us.
Heavenly Father, we gathered together on these grounds a little over 13 months ago and asked your blessing upon this endeavor when we turned over the very first shovelfuls of the good earth. Tonight we celebrate completion of construction and the beginning of patient care.
I am very honored to be here this evening representing all of the patients and all of the survivors of this wonderful practice. When I made a few comments at the groundbreaking, I used the words nothing but the best over and over to describe Cancer Care Specialists of Central Illinois. And I think this evening with the opening of this building, it's yet another demonstration of their best efforts. So thank you very much, and I'll be pleased now to cut the ribbon.
The patient comes in here and they lay in the position that they'll be treated in, and we do a CAT scan of them in that position, and that's transferred to our treatment planning system where the doctor can sit with the dosimetrist and generate a treatment plan for each patient.
This is the linear accelerator. Can you tell us about this, this gizmo?
This is a Novalis TX linear accelerator. Able to do CAT scans of the patient before treatment to make sure they're in the right position. Next spring, 2010, we'll be upgrading this machine to be able to do stereotactic radiosurgery, which is even more precise treatments, and they're able to give their treatments in 1 to 5 days as opposed to 30 to 40 treatments. So very accurate, and just gets the patients in and out in less time and less side effects.
You look happy about this.
I do. I cannot wait for this. Cannot wait.
Art therapy, we work with people to help them with whatever kind of issues they're working on. Right now we're working on art therapy as pain management, depression, elevation, mood elevation, sort of a thing. These are tiles that are made by people who were in trials who had cancer, and family members and art students, people with family members who've had cancers, and they're made for inspiration. They'll be in the entry room when people walk in.
This is a clinical research department. We do treatment trials, and we do prevention trials, and we do symptom management trials. And our responsibility is to help the physicians next door when they think that a person is eligible for a clinical trial. We go over and help them look at the eligibility, help them get them onto the trial, and then we follow up by doing the data management and following the patients for what kind of side effects and response they have to the treatments afterwards.
So do you work with drug companies, or?
We both work with drug companies, and we are part of a community clinical oncology program that we belong to different groups across the United States, and we acquire trials through them too, through the National Cancer Institute.
This area is where physicians see patients. We have 12 exam rooms and 3 procedure rooms, and so it's by by having that many rooms, it's been a lot faster for people to get in and get out, so they don't have so much waiting time. Most everyone will get lab work drawn first before they come here to see the doctors, and then depending on what they need, they may either go back to infusion or they just may get up a follow-up appointment for us.
Does the lab work happen in this building as well?
It does. We're very fortunate. Our patients can have their lab work, see their doctor, and get their treatment on the same day, which really cuts down on driving time. A lot of our folks come from out of town, so if they can do it all in one trip, it saves on their gas. It saves one day to be away from their hometown or their job, and so that's one of the benefits to having it here.
This is the great room that we're most proud of, primarily because that is the most difficult things that patients have to go through when they come in here, is to go through the dreaded chemotherapy. So the intent is to try to make things as comfortable for them as possible. So let's go to the infusion area. By the way, I have to tell you something. This is a patient service coordinator room, and it's a service that is provided for patients who may have difficulty in securing their chemotherapy. Many of them may have financial problems. They may have no insurance but needs treatment. They may be working, but then all of a sudden they are unable to work, so they're disabled, right? So they have to apply for disability. Leanne, who's our patient service coordinator, will contact the necessary offices to try to get help for these patients. And that's her job exclusively, and that's what we hire for. And I don't think anybody has a service like this in any chemotherapy or medical oncology place in Central Illinois. These are treatment areas that are private rooms. So when patients come in and they need to have a private room for a number of reasons, some of them do not want to be in crowds, or they may have very low white blood cells, so they are more susceptible to infection, so we keep them away from the crowds. We like to make it as comfortable as possible, so color the rooms as friendly as we can. They have their own private television. There's nurse call lights, of course. And usually these are the areas where patients may have to stay here 6 to 8 hours for chemotherapy. And so we have 10 of these private rooms to make them as comfortable as possible. And the great room is here. So this is the chemotherapy area. We'll go out this way. And so each of these are chemotherapy chairs. All right, as you can see, each one will have their own chairs. They can hook up to Wi-Fi if they want to. And we try not to have too much television because it's too noisy. All right. So it looks out to the YMCA, but at the same time, back in the back, which we can't see right now, it looks into the woods. Hi, Sharon. And there's a pond back there, and it's warm, cozy, we think, even if it's such a big room. There's opportunities for patients to socialize, but at the same time, they can have their own little private corner, so to speak. So this is what we're really most proud of, is the chemotherapy infusion area.
Looks like there's a special feature over on the wall.
Yes, well, it's a
take a look at
saltwater
that.
tank, saltwater fish tank, I should say. And it's just a way to distract patients. And although they're not there, they're behind, as you can see. They come out. And it's just something to distract patients. And funny thing is that many of these patients have, they think, private relationship with one of the fish. They have their own favorites. So it's something we're proud of. And it's something that's soothing. The water is very soothing, the sound. And so we're very proud of it too. It's just something different, something very different. And as you can see, the nurses' station is wide and it's easily accessible to all the patients. Right? So if they need something, they can call and it's available. Okay? All right.
Thank you for joining us on a Catch Mini tour of the new Cancer Care Center of Decatur.